March is Colorectal Cancer Awareness Month. Darcy Connor joins us live right now to talk about some of the free screening services available. Darcy is the program coordinator for the Cancer Services Program of the Greater Capital Region. Good morning, Darcy.
Good morning. Thank you for having me.
First of all, can you tell us a little bit about the Cancer Services Program?
Yes, the Cancer Services Program is funded by New York State Department of Health. We are considered the Cancer Services Program of the Greater Capital Region. We cover Albany, Rensselaer, Saratoga, Columbia, and Greene counties. We offer free cancer screenings to people who don't have any health insurance between the ages of 40 and 64. So it's breast, cervical, and colon cancer screening.
Great. And who is eligible for these services?
People who don't have health insurance between the ages of 40 and 64.
And today, as we mentioned, it's Colorectal Cancer Awareness Month, so we want to talk about colorectal cancer screenings. Who should be screened and how often?
People at average risk should be start to be screened at 50 years old. Our program, that's our guideline, that's our target population, 50 to 64. If somebody is high risk, meaning they have a first degree relative, which is a mother, father, brother, sister, who has been diagnosed with cancer, with colon cancer, they should be screened at an earlier date, in 10 years prior to when their relative was diagnosed.
And what types of screenings are available, and what types of screenings do you typically offer for colorectal cancer?
For colorectal cancer, the most common is the colonoscopy. But people that don't have health insurance, that's a very expensive test. So the New York State has allowed us to use a FIT kit, which is a similar to what used to be a stool sample, but you don't have to sample the stool anymore. It's just a swipe with a brush. And I have a paintbrush right here. So it's called a FIT kit, and what it is you would have a bowel movement. The bowel movement in the toilet, you take a little paintbrush that comes in the kit, and you just swish it on top of it. Then you take whatever's on the brush and you put it on a little card that goes directly to the lab. When it goes, you need to do 2 for 1 day. So it's 1 bowel movement, and you do 2 samples. So you do 2 different times, but it's at the same bowel movement. And you swipe it and put it on these little cards, and then you seal it up and send it to the lab, and then the lab will determine if there's blood in your stool. If there's blood in your stool, that's an indication you may have a polyp, which may be cancerous, and that's what detects it, so you would want to get rid of that polyp so you don't get colon cancer. Our program would allow you to have, as soon as we get a positive, which blood in your stool, then we would pay for the colonoscopy. So that would be covered completely by the Cancer Services Program and funded by New York State.
Great. And if I'm a patient and that initial test comes back positive, and then I go for a colonoscopy and say that comes back, positive for some type of malignancy, how does your program help me then going forward throughout treatment?
So what's fantastic about this program is we offer the Medicaid Cancer Treatment Program, which is the fast track to Medicaid if you're diagnosed with breast, cervical, or colon cancer through this program. We also have a case manager that once if there is a positive diagnosis, you go directly to the case manager, and she would follow you through and make sure that you were able to get the Medicaid Cancer Treatment Program, or for some reason if you weren't, help you get any services you need to make sure you get the care you need.
Great. And do you have any free screenings coming up?
Yes, actually we do. So we have specific screenings for Colon Cancer Awareness Month. We have March 9th in Troy at the Atrium at the Farmers Market. We will be there, and Sue McAvoy, who is our outreach coordinator, she'll be there and distributing FIT kits. So people can go right there and pick them up. But if people want to ask questions before they go, they can call us at 518-525-8680 just to get a little bit more information. We also have one in Hudson, which is at the Bliss Towers in Hudson, which is in Columbia County, and that will be from 11:30 to 1 on March 28th.
Great. And of course, we will post this information on our website at sphp.com. And if I do want to show up for any of these free screenings, do I have to do anything in advance?
No, just come. And you know what's another really great thing about the Cancer Services Program? We can do most of this over the phone. So people can contact us. We can get all their information over the phone. Because we also, we would set people up for a clinical breast exam, a pap smear, a mammogram. We can do it all over the phone. The only thing they have to do is sign a consent form saying they know what our program covers and how it works. And that form has to be sent back to us. But otherwise, we can do everything over the phone.
really incredible service. Thank you so much, Darcy Connor. Appreciate you talking with us today.
Thank you so much.